name is Tertia Albertyn, and I call myself a mother, a baby maker, and a blogger. I co-founded Nuture Egg Donor Agency 9 years ago, and when people ask me what I do, I say I help people have babies. Nuture has over 600 egg donors who are available to donate to couples who need donor eggs in order to conceive. I have my own infertility story. We struggled for 5 years to have children. We did many IVFs, many procedures, lots of losses. We eventually conceived on our 9th IVF, and we have boy-girl twins who are now 12. And then at age 40, I fell pregnant naturally. Who knew that sex could result in having a baby? What a surprise. And now I have 3 children, twins who are 12 and a 7-year-old. About 6 years ago, a friend of mine who'd been through infertility herself came to me and she said, "You've got to meet this woman called Nicola. She's a fertility astrologer." So I was very skeptical. I said, okay. I walked in and I met this really professional looking woman. So I sat down across from her with my arms crossed like this. I said, "So, tell me a bit about myself." And she looked at my chart and she asked me for my details, and then she started saying one or two things which only people really close to me, or some people wouldn't even know. There were secrets, inside secrets. I could not believe it. So I thought, okay, you know what you're talking about. And then we started discussing, she's been through infertility herself, and so we had quite a lot in common. And then we started exploring how we could use what she could do for the benefit of our customers and patients. When you're going through infertility, you feel so out of control. You're at the mercy of the doctors, of your own body's failures. You feel like a failure. You feel really out of control. So when you're a veteran infertility patient like I was at the time, you will actually do anything. So you start searching for ways in which you can help the journey, help yourself, take some control back. And Nikki offers that. People think of astrology as a predictive thing, crystal ball gazing, looking that you will be pregnant, or you will have 3 children, or you will have a boy. It's not like that at all. Nikki helps patients in 2 ways. First of all, she talks about timing. Now, I always say to patients, there's only so much that doctors and scientists and medical technology can do. They can get the best eggs, they can do the best transfer, they can have the best medicine, but it doesn't always work. Why? Because there's a part that's up to God, fate, nature, the universe, call it what you want, that influences the outcome of your fertility treatment. On paper, it could look, this should definitely work statistically, and yet it doesn't. And what Nikki brings in is what we talk about timing. When is the best time to do it? And that's not something that a scientist can tell you or a doctor can tell you. And that's what Nikki offers. So it's a sense of getting some control back as a patient, taking control of my own cycle. That's number one. Then from my business point of view, from the egg donor side, we have patients that come in that have been told after trying for many years that their eggs don't work. They need to choose an egg donor, which is it's a big thing. No one grows up thinking they're going to need an egg donor one day to have a baby. You grow up thinking, I wonder if my child will have my funny ears or my funny smell. They get a few baby pictures of the donor, and then the donor writes about themselves. So they have to choose the future DNA, or the DNA of their future child, based on an anonymous profile. How do you do that? How do you choose? It's such a big thing. And that's where Nikki plays such a huge role. Because what Nikki does is the recipients will come to us, they'll have a look and they'll say, these are my top 3 choices. I like these 3 donors, but I'm not sure which donor is right for me. They go to Nikki, and I give Nikki the donor's birth details, their date and time and place of birth. She says this donor's narrative fits in with the mom-to-be's narrative, whatever that means. In astrological terms, I don't know. But in my understanding, she helps recipient couples choose a donor that's right for them. Fertility astrology is something that I would have never considered before. I am a skeptic. I'm not religious. I'm not spiritual. So I'm quite practical. I think that's what I like about Nikki. All I know is that it works. And as an infertility patient, I know for myself, I want something that works. I don't care how, I don't care why, I want it to work.